A great day to all delegates and presenters at this conference. I am more than delighted to be here, so thank you very much from Blonde State University and to all supporting institutions. Thank you very much for having me, and my advance congratulations for successfully organizing this momentous event. As mentioned, my name is Mark Gabriel Wagan Aguilar. I am from the Philippines, and I am here to share a very important study entitled Oral Hygiene in the Philippines, a basis for community health programs development. So allow me to start with the rationale of my study. All right, so we all know for a fact that health is wealth. We always hear it from people, and it is actually correlated with our capability to do things because basically, if we are not healthy, then we would have limitations to what we are allowed to do and what we can actually do. Now, the term health is actually a general term, but we can be specific depending on which aspect we are talking about. It could be physical health, neurological health, reproductive health, oral health, and many more. But if there is one aspect that we Filipinos tend to less prioritize based on my observation, it would be oral health. Based on the findings of DOH or the Department of Health here in the Philippines, 87% of Filipinos suffer from tooth decay and 43% have gum disease. While it was also found out that oral problems that cause discomfort, pain, and infections are 12 times more likely to hinder children from their school and daily activities, which results to inactivity, absence, and poor academic performance. With this data, it is very clear that here in our country, oral health is overlooked. There could be a lot of reasons behind it, but maybe this is because of the lack of knowledge about the importance of it, or probably because Filipinos in general do not know the proper way to take care of their oral cavity, particularly their teeth. Now, we might think that this is okay. There are people who might say that it doesn't matter because we can hide it, we can just close our mouth, right? And it can easily be cured once you have experienced any problems with it. But what most of us do not know is the fact that there are actually serious repercussions should we continue to neglect our oral health. In fact, according to literature, poor oral health leads to chronic diseases like diabetes and heart disease. It has also a serious impact on one's social life and career, as it has been proven in so many times that people who have oral problems develop a very low self-esteem or confidence. And this actually results in poor social life as well as their hesitation to face and communicate with people in the professional work environment. Now, it is public knowledge that here in the Philippines, chronic diseases, particularly heart disease, are the number one cause of death based on the reports by the Department of Health and the Statistical Research Department. And also, it is public knowledge that we continue to have unemployment as a primary societal issue. So, with the information that I have gathered, if we are going to connect the dots, it is easy for us to say that there is a huge possibility that ensuring the practice of oral hygiene in communities might actually contribute to solving these challenges. I mean, if we want community development, if we want healthy and progressive communities, which translates to economic development, then this is one thing that we have to focus on. However, before we get to implement health programs, we must first learn about people's perception and actual practices. And this actually motivated me to conduct this study. Now, guided by a descriptive research design taking on quantitative research approach, I have determined the perception and practice of Filipinos in terms of oral hygiene. And then using some of what literature have suggested to be the right way to take care of our teeth, I was able to know if they are compliant, uh, or if Filipinos are compliant or not, particularly in terms of toothbrushing, replacement of toothbrush, and going to the dentist for a checkup. Now, these were the criteria that I have followed to measure the compliance of the people on oral hygiene practices. This is in reference to the Center for Disease Control and Prevention in the United States of America. I'm not going to read this one by one because we only have a limited time for this presentation. All right, so results show that in terms of the importance of oral health as perceived by Filipinos, the majority or 84% believes that it is very important and it shouldn't be neglected, while 16% thinks that it is important but shouldn't be taken as a priority. Then for question number two, that has asked the respondents how often they visit a dentist. Sadly, the majority or 39% only goes once every 2 years or more, while 27% visits a dentist as prescribed, which is at least once every 6 months. And what is quite alarming is that there is 15% who have never been at a dentist clinic since they were born. Then, when it comes to the number of times they brush their teeth daily, results turned out to be positive, given that the majority or 85% adheres to what is prescribed, which is to brush teeth at least twice a day. However, there is 11% who only brush theirs once a day, and 4% express that they do it irregularly, and sometimes they forget to do it in a day. I have also learned that in regards to how much time they spend brushing their teeth, most people or 70% complies with the right duration, that is at least 2 minutes. But there is still 25% and 8% who do it in a minute or less, respectively. And then lastly, about how often do they replace their toothbrush, the result was also positive in general, provided that 68% is compliant with the advice of professionals, which is to replace their toothbrush every 3 to 4 months. However, 24% who are not compliant uh, uh, only replaced theirs after 5 to 6 months of use. And what is worse, there is 8% who actually wait for a year before replacing theirs. So, clearly, though in general the Philippines observe oral hygiene and have that positive attitude towards it, they still need to improve their compliance in some areas, particularly visit to the dentist to ensure that their oral health is fine. Additionally, though it is only a small portion of the population, I mean, we are talking about 5 to 25%, there are still risks faced by some Filipinos with their poor oral hygiene practices. Hence, something that the government must address as soon as possible. Now, from the results of this study, I have made the following recommendations. Number one, actually, I have a lot of recommendations, but for the sake of this presentation and the limited time we have, I have only selected four. The first one is there must be programs implemented at the community level that are not just focused on giving away oral hygiene kits. There must be events that teach people the significance of oral health and its effects on the overall health of a person. The government and those concerned private organizations must directly inform people of the consequences of having a poor oral health so that these programs would be highly influential and would really result in realizations. The second recommendation is I have realized that both public and private sectors really do not consider oral health as a major issue, which is one of the probable reasons why the general public also do not see it as a big deal. Therefore, oral health is hereby recommended to be a part of the employment assessment so that people would be encouraged to adhere to it. And then, third recommendation is as the first people who should be teaching children what is right and wrong, the parents are hereby advised to teach their child or children the importance of oral hygiene and the basic ways to have it. Parents must impose this on their children so they would take it seriously as they grow up. And then lastly, there are questions that I was not able to answer through this study given the method that I have followed. Uh, so I was not able to give explanations to questions such as, but not limited to, why do Filipinos don't go to the dentist for a regular checkup? And why don't some people follow the prescribed toothbrushing duration and frequency, despite seeing oral health as something to be prioritized and highly important? Therefore, these are research gaps that could be explored by researchers in the future. All right, so this ends my presentation. Thank you very much again to Romblon State University here in the Philippines, particularly to all the members of the conference committee. I would like to commend each and every one of you for your dedication in promoting research on a global scale. Have a great day, everyone. Thank you once again.